You are listening to KILJ, filling in for Katie, who usually takes over the Henry County Health Center. FYI, today I've got it, Nathan Bleckel, and I'm joined today by a man who needs no introduction, Medical Director, Physicians and Clinics of Henry County Health Center. It is Dr. Joel Ryan. Joel, thanks for taking some time and chatting with us, and I'm also under the impression you've got a guest on your end of things as well.
Yeah, absolutely. Thanks for having us today. Trina Smith is here with me. She's a nurse practitioner who also works in our clinic here in Mount Pleasant and goes over to New London on Thursdays. So she's going to introduce herself later on here. So, yeah, thanks for having us.
Absolutely. So let's get right into the nuts and bolts. Dr. Ryan, as Medical Director of Physicians and Clinics at the Henry County Health Center, can you give us some information about those clinics?
Absolutely. So what we've developed over the last couple years now, basically, is a network of 4 clinics, all owned and operated through Henry County Health Center. So we have a clinic here in Mount Pleasant at the hospital, and then we also have clinics in Wayland, Winfield, and New London. And what we do is we provide primary care at each of those locations, along with still women's health care here at the clinic in Mount Pleasant, and we also have acute care services now that we offer here in Mount Pleasant.
Awesome. Where are the 4 clinics located, and who are the providers?
Yep, so we have different providers. Each of those clinics has a provider that staffs the services there. So here in Mount Pleasant, I work here as well as Trina Smith and Ashley Greiner doing primary care. Kendra Bonison does some primary care along with women's health care, and then Carrie Payne does women's health care here as well. Those are our nurse midwives who still take care of some obstetric patients here now, although they do deliveries at Great River. Up at Wayland, we have Ashley Greiner and Jesse Richmond, both of providing services there. And Jesse Richmond also works here in Mount Pleasant as well, 2 days out of the week. They cover Winfield and Wayland both, and then Sylvia Graver works in New London along with Trina.
Dr. Ryan, physicians and clinics are designated as rural health clinics. What does this designation mean, and how does having 4 clinics throughout Henry County benefit area residents?
Yeah, so kind of the easiest way that I have to explain this to people is the rural health clinic designation is similar to the critical access hospital designation that we have here as a hospital. It means that there's a defined need here in Henry County for additional providers and additional health care. It's an administrative designation that we have with Medicaid and Medicare. From a patient standpoint, there's not a whole lot of difference, honestly. We see Medicare patients, we see Medicaid patients, we see patients with private insurance such as Blue Cross. If you have insurance through your workplace, we see those patients as well. Now, one of the benefits that we have is we have an electronic medical record here at the clinics. And what that means is that we can see your chart at any of the locations. So if you're being seen in Wayland one day and then Mount Pleasant later on for acute care, your record can be accessed at any of those spots at any time. So there's no interruption in service no matter which location that you're at.
Starting June 15th, physicians and clinics in Mount Pleasant transitioned the Henry County Respiratory Care Center to include acute care services. First, why was acute care included in the services offered? And the clinic in Mount Pleasant also provides primary care and women's health services. Can you explain the difference quickly between acute care and primary care and describe the services offered for each?
Yeah, so we actually started the acute care services back in March, I believe, when we went through a number of changes as COVID became prevalent. We had to make sure that we had safe spaces for both our regular primary care patients as well as patients who were ill with respiratory type symptoms. As things have progressed with COVID, we've realized that need is going to be present for quite some time. So we've developed the acute care service clinic, which is a clinic that you can call and come in and be seen that same day. We do even have walk-in appointments available. We've expanded the services there. It's not just respiratory services at this point. We can see you for any of your acute needs, whether that's some poison ivy or sunburn that's happened over the summer here, being outside on holiday weekends, bug bites, trauma, kids fall and break things. We can help take care of that, those issues as well. So we've expanded the services, and we want to make sure that people know that those services are available to anyone in the county. If you're not currently a patient here at the rural health clinics, we'll make sure that the information from your visit gets sent to your primary provider. So that's on the acute care end of things. Women's health is still a big part of our clinic here. We have our nurse midwives, Carrie Payne and Kendra Bonison, who provide those services. And they do provide prenatal care here at the clinic. Like I mentioned, they do deliveries over at Great River Health Systems now. There's been information out about that over the spring and summer, and that started happening here June 1st with the change in practice for the deliveries. But women's health services are definitely still available here. And then regular primary care. We see continuity patients that we will follow along with to help manage your chronic medical problems, which can include, diabetes, heart disease, COPD, any of those chronic medical illnesses, and then well care as well. So regular checkups for your kids. And Trina's been doing some of those, and Trina is also relatively new to the clinic. She's working on expanding her patient panel and has room for new appointments. So that's why we have her today with us as well.
Awesome. So I guess for Trina, like you said, you're accepting new patients, and same-day appointments can be made as well. Are walk-in appointments possible right now?
Yes, for patient convenience, walk-in visits are available at our acute care services clinic.
All right, perfect. Another question that I have here today is, with area youth getting ready to go back to school, child exams, sports physicals, they're on top of the mind for parents. Can physicals be scheduled at physicians and clinics?
Yes, this is a great time to update well-child exams and sports physicals in preparation for the upcoming school year. To schedule an appointment, call 319-385-6540, and we can get you scheduled to be seen.
All right. Well, guys, it's a pleasure catching up with Henry County Health Center again. It's been a little bit of a long time for me, since Katie's been back. She's been handling these, but it's fun to get back out there and talk Henry County Health Center. You guys are doing a terrific job right now. So, Dr. Joel, appreciate it. Trina, thank you for jumping on the program as well. And we wish you guys the best of health moving forward, and we'll be in touch.
Okay.
Thank you.
Thank you very much.